welcome to a new edition of Dateline Cls. Today we get to explore the life of a college student, but not just any college student, usually worried about late nights cramming, next week's homecoming, or the latest trends. Instead, meet Jessica, a student who is struggling with sickle cell disease every day. Here she shares with us her story. Jessica, a 22-year-old student studying at the University of Chapel Hill, tries to balance her everyday life with sickle cell disease. Between class time and studying, she also visits her local hospital's apheresis center to undergo routine red blood cell exchange. Here, normal donor red blood cells replaces her abnormal cells. Along with the exchange, she routinely takes prescription drugs, hydroxyurea, to help increase her fetal hemoglobin in order to compensate for her sickle cells. Here she shares with us her story with our news correspondent, Kyra. Hi Jessica, thank you for joining us today.
Hi Dr. Nicholson. You're welcome.
Alright, how are you doing today?
I'm doing well. How about yourself?
I'm good, thank you. Alright, well, today we're going to talk about your sickle cell disease.
Okay.
So I'm just going to ask you a few questions, if you don't mind.
Okay.
Well, first of all, when did you first discover you had sickle cell disease?
Well, actually, I've had it for as long as I can remember. So this is the life I've only known.
Wow. That's really amazing. Alright, well, now that you're a student here at Chapel Hill, UNC Chapel Hill, how would you say that college and life has been managing sickle cell disease as a student?
I feel like it's been a little bit rough, seeing that I have to go in for routine procedures like red blood cell exchange, and I guess that's an inconvenience. I take a pill every day. It's called hydroxyurea, and from what I know, it's supposed to help increase the fetal hemoglobin, which is a normal hemoglobin. It has a normal oxygen carrying capacity as hemoglobin A, which I lack because I have sickle cell disease. So by taking that, it reduces the chances of me having a sickling crisis. So in that aspect, that really helps.
Very interesting to hear about some of the treatments that you've used thus far. I don't know that much about sickle cell disease, but I've heard of things such as bone marrow transplants being used to help treat the disease, as well as gene therapy. Have you considered any alternatives?
I think because I'm managing my disease as well as I am, and the treatment options are working, I haven't really looked at a method as drastic as bone marrow transplant, because any procedure has risk and things of that nature, like graft versus host disease. So I'm quite content with taking a pill every day and possibly having to go in every so often. Gene therapy, I am actually about to go and talk to a genetic counselor about. I've heard certain things and they've had some successes, but I really don't know exactly how far they are when it comes to sickle cell disease and if I'm actually a candidate.
As Jessica waits to be a candidate, gene therapist Dr. Jerica works towards treating patients like Jessica. Finding promise with the current progress of gene therapy, she continues her research on improving the efficacy of viral vectors to correct sickle cell genes. Go.
Gene therapy is a new and experimental technique that uses genes to treat and prevent diseases within the patient's cells. Gene therapy is on the forefront of treating sickle cell disease. Vectors are how the genes are transmitted into the patient's cells, and they carry the genes to correct the mutated gene within the patient. These gene therapies benefit the patient in many ways. They allow the patient to live a normal and healthy life without going to the doctor for transfusions or hydroxyurea, and also allow for a curative treatment rather than a bone marrow transplant.
Hi, Dr. Snow. How are you?
Good. How are you doing, Jessica? So what can I help you with today?
So I've been doing some research on sickle cell disease, and I found that they've tried different gene therapy methods, and I was wondering if you could give me information about it. Is it a feasible option for me or anything like that?
Okay. Well, yeah, gene therapy is up and on the rise. There's a lot of interest in it, and it's been used in other diseases, but for your particular case with sickle cell, it's not been yet accomplished in a human but they haven't yet done any clinical trials with sickle cell. But maybe in the next couple of years, there might be something evolving in some clinical trial that you can get into if you're interested.
Okay, well, thank you.
Yeah, thanks for coming by.
You're welcome.
Hi, Jessica. Nice to see you again.
Nice to see you again as well.
All right, take a seat.
Okay.
How was your meeting with Dr. Snow?
It went really well. It was very informative.
What were your thoughts after meeting with her?
I don't know. I thought that, she informed me there are a lot of advancements in gene therapy and that they've made a lot of improvements.
Right, well, thank you for that information. To wrap everything up and just as a conclusion, what can you say to other students that have sickle cell disease?
I would say, be compliant with your medication. Do not allow it to limit you on what you feel like you're able to do. And just keep a lookout for gene therapy. I feel like within the next 10 years or so, technology will probably allow us to be able to cure sickle cell disease through gene therapy.
Thank you, Kyra and Jessica. Like Jessica, many fight to live a comfortable life with sickle cell disease, waiting for the day gene therapy will be a proven cure. Until then, all we can do is hope and wait. I'm Helen. Thank you for tuning in another edition of Dateline CLS. Have a great day.
Dang it.
Okay, cut.
Okay, great. Yes, I think the answer is that such and such and such and such
That have sickle cell disease with our news correspondent, Kyra. I don't like that one.
Correct the genes within the patient, and what
I
else?
might have to have you say that again.
No, what else?